Welcome. If you are new, please like, share, subscribe, comment, and click the notification bell for updates of my new video. In a hiatal hernia, the opening in the diaphragm through which the esophagus passes becomes enlarged, and part of the upper stomach tends to move up into the lower portion of the thorax. There are two common types of hernias, sliding and paraesophageal. Sliding or type 1, hiatal hernia occurs when the upper stomach and gastroesophageal junction are displaced upward and slide in and out of the thorax. This occurs in about 90% of patients with esophageal hiatal hernias. The less frequent paraesophageal hernias are classified by the extent of herniation. Type 1, Type 2, Type 3 or Type 4, and occur when all or part of the stomach pushes through the diaphragm beside the esophagus. Hiatal hernia occurs more often in women than in men. Clinical manifestations of sliding hernia: heartburn, regurgitation, and dysphagia. At least half of cases are asymptomatic. Often implicated in reflux. Paraesophageal hernia. 1. Sense of fullness or chest pain after eating or may be asymptomatic. 2. Complications of hemorrhage, obstruction, strangulation possible. 3. Hemorrhage, obstruction, and strangulation can occur with any type of hernia. Types of hernias. Type 1, sliding hiatal hernia. Type 2, paraesophageal hernia. Type 3, mixed. Type 4, paraesophageal hernia. Diagnostic findings. Diagnosis is confirmed by X-ray studies. An X-ray is a photo taken with a machine which passes electromagnetic radiation through the body, capturing an image of the internal structures. A barium X-ray is a radiographic X-ray examination of the gastrointestinal tract. Barium X-rays, also called upper and lower GI series, are used to diagnose abnormalities of the GI tract, such as tumors, ulcers and other inflammatory conditions, polyps, hernias, and strictures. Fluoroscopy. This is a type of medical imaging that shows a continuous X-ray image on a monitor, much like an X-ray movie. During a fluoroscopy procedure, an X-ray beam is passed through the body. The image is transmitted to a monitor so the movement of a body part, or of an instrument or contrast agent, through the body that can be seen in detail. Medical management. 1. Frequent small feedings that easily pass through the esophagus are given. 2. Advise patient not to recline for 1 hour after eating. This is to prevent reflex or hernia movement. 3. Elevate the head of bed 4 to 8 inches blacks to prevent hernia from sliding upward. 4. Surgery is indicated in about 15% of patients. Paraesophageal hernias may require emergency surgery. Medical and surgical management of paraesophageal hernias is similar to that for gastroesophageal reflux. Antacids, histamine blockers, gastric acid pump inhibitors, or prokinetic agents such as metoclopramide, cisapride are indicated. Nursing process. The patient with esophageal condition and reflux. Assessment. 1. Take a complete health history, including pain assessment and nutrition assessment. 2. Determine if patient appears emaciated. 3. Auscultate chest to determine presence of pulmonary complications. Diagnosis. 1. Imbalanced nutrition, less than body requirements related to difficulty swallowing. 2. Risk for aspiration due to difficulty swallowing or tube feeding. 3. Acute pain related to difficulty swallowing, ingestion of abrasive agent, a tumor, or reflux. 4. Deficient knowledge about the esophageal disorder, diagnostic studies, treatments and rehabilitation. Planning goals. Major goals may include adequate nutritional intake, avoidance of respiratory compromise from aspiration, relief of pain, and increased knowledge level. Nursing interventions. For adequate nutritional intake. A. Encourage patient to eat slowly and chew all food thoroughly. B. Recommend small frequent feedings of non-irritating foods, sometimes liquids with foods helps passage. C. Prepare food in an appealing manner to help stimulate appetite, avoid irritants like tobacco and alcohol. D. Obtain a baseline weight, and record daily weights, assess nutrient intake. For decreasing risk of aspiration. A. If patient has difficulty swallowing or handling secretions, keep him or her in at least a semi-Fowler's position. B. Instruct a patient in the use of oral suction to decrease risk of aspiration. For relieving pain. A. Teach patient to eat small meals frequently, this is 6 to 8 meals daily. B. Advise patient to avoid any activities that increase pain and to remain upright for 1 to 4 hours after each meal to prevent reflux. C. Elevate the head of bed 4 to 8 inches blocks, discourage eating before bed. D. Advise patient not to use over-the-counter antacids because of possible rebound acidity. E. Instruct in use of prescribed antacids or histamine antagonists. Promoting home and community-based care. Teaching patient self-care. 1. Help patient plan for needed physical and psychosocial adjustments and follow-up care if condition is chronic. 2. Teach patient and family to use special equipment, maybe enteral or parenteral feeding devices, and suction. 3. Help in planning meals, using medications as prescribed, and resuming activity. 4. Educate about nutritional requirements and how to measure the adequacy of nutrition, particularly in elderly and debilitated patients. Continuing care. 1. Arrange for home health care nursing support and assessment when indicated. 2. Teach patient to prepare blenderized or soft food if indicated. 3. Assist patient to adjust medication schedule to daily activities when possible. 4. Arrange for nutritionist, social worker, or hospice care when indicated. Evaluation. Are expected patient outcomes. 1. Achieves an adequate nutritional intake. 2. Does not aspirate or develop pneumonia. 3. Is free of pain or able to control pain within a tolerable level. 4. Increase knowledge level of esophageal condition, treatment, and prognosis. Thank you for watching. If you want to study nursing anywhere, please subscribe, like, share, and click the notification bell for updates of my new video. If any concerns, just comment below.